Hello and welcome to Safe and Sound with CCOHS. Today we're joined by Dr. Arif Jetha, a scientist at the Institute for Work and Health and associate professor at the University of Toronto's Dalla Lana School of Public Health. Dr. Jetha studies how the future of work and artificial intelligence in particular affect the health, safety, and well-being of workers, particularly those most vulnerable to being left behind by the rapidly changing landscape. He recently led a team of global experts in a research study anticipating work and health challenges likely to arise by 2040. Welcome to the show, Dr. Jetha.
Thanks so much for having me. I'm excited to be able to present on some of this work.
So, throughout the course of this research, your team scanned nearly 400 different signals of change to arrive at 7 major trends. Can you walk us through what the process looked like and how that picture started to come together?
Yeah, so I think it's important to start off by just describing the approach that we utilized. And so we use this approach called strategic foresight. And the goal is to develop a picture of what the future could look like. It's not necessarily about predicting the future, it's about just kind of understanding different potential futures. And one way to do this is by scanning signals of change. And what that means is our team, which was international, we looked at academic references, which are references that are peer reviewed and ones in which folks at the Institute and myself tend to kind of work with more regularly. But we also looked at like fringe sources, less traditional sources, so blog posts,
Okay.
social media posts, and the goal was to like think about how different people, different knowledge leaders are thinking about potential changes that could emerge on the horizon. And sometimes some of the most kind of speculative changes are ones in which they lead to more interesting conversations. They allow international multidisciplinary teams to kind of think about these future changes and to engage in a conversation on resilience.
That's exciting. The report describes this as a moment for a bold reimagining of how we define workplace safety. What does that look like in practice?
Yeah, well, I think first and foremost, it looks like health and safety leaders thinking a little bit more about potential changes that could occur on the
Mm,
horizon. I think oftentimes we are so bogged down in what's happening right now, which is not surprising because what's happening right now
right.
can be quite difficult. There's
A
a lot of
lot.
complexity in our world in its current state. But I think while we are tackling the now, we should also be thinking about how things could change in the future. And the reason why we should be doing this is because things are changing really fast.
Mhm.
We know things are changing technologically at a very rapid rate, and what the world of work looks like now will be completely different than what it looks like in a year or 2 years from now. We know that social, economic, political changes, they're happening much more rapidly than I think past periods. And I think it just takes a kind of a more strategic perspective to kind of think beyond what we're currently looking at and and consider what could happen as a way to make policies and practices resilient to the now as well as to the potential future.
Right. And I think that's a good segue. The report covers a broad range of factors, and you've just touched on a couple of these from, geopolitics to AI to climate. Which do you see as the most urgent occupational health and safety priority heading into the next decade? And obviously, I think a lot can change in a short amount of
Yeah.
time, but
To be honest, I don't know if I would rank any of the different trends that we identified in our report, but I will say that there were some that were, I think, interesting and provocative to our group. So
okay.
I think obviously we know that um, digital technologies are kind of advancing at a rapid rate, in particular, the adoption of artificial intelligence. And I think what that can mean for health and safety leaders is a lot. So I think on the one hand, the utilization of the tool will potentially make work more productive and potentially help workers by removing them from unsafe and stressful situations. But on the other hand, it's changing working conditions, both physical and psychosocial, in ways that I think we are very unclear about at this current stage, and that's pretty scary because
Right.
workplaces are adopting these tools, but I think in the health and safety field, we aren't as prepared to tackle some of these changes to our work environment, some of the hazards that could emerge as a result of utilizing these tools. And I think kind of in conjunction with that is that employers, I feel, are maybe unprepared as well, or like health and safety leaders who are situated within organizations. and kind of compounding that challenge is the fact that things are happening at a rapid scale, a rapid pace, and it requires health and safety leaders to have a lot of like technological savviness, which I think in the past hasn't been in our like job descriptions, but I think
Right.
that's quickly changing.
If there's one thing you hope employers and policymakers take away from the findings, what would that be?
Yeah, I think the overarching message that thinking from a future focused perspective can allow you to develop your strategies, your programs, and your policies, which keep both an eye on the now as well as an eye on the future. And I think if we are able to create approaches to health and safety that are relevant to the present, but also consider the different potential changes
Mm,
that could occur on the horizon, to me, that's a win. And I think that's a good way of kind of bringing together the now and the future. And I think for me, that's probably what I would really encourage folks to think about. I think the other thing is that a lot of the changes, especially those that we identified in the report, it's kind of like the system of changes, right? Like uh, technology is affecting our like social lives, both inside and outside of work,
mhm.
our kind of our the way that we integrate or interact with the environment, the physical environment, that is affecting or that is related to our use of technology. It's related
Right.
to like social and political changes. And so I think we can't often tease apart these changes because they're interconnected. And I think maybe it's a bit of a mistake if we just focus on just technological changes without
Silos.
kind of,
Yeah.
yeah, without thinking about the broader social and political like systems that they're embedded within.
Yeah, a lot, there's a lot to unpack there. So, thinking about from the workers' perspective, what is a key takeaway for workers that are trying to navigate some of these new challenges?
Yeah, so I think one thing is that we need to kind of build literacy in a lot of these uh, kind of changes that are occurring around us. So if we take technology, for instance, because I think that's a one that we can kind of wrap our heads around a bit more. I think we got to know what artificial intelligence is, what are the digital technologies that we're working with on a day-to-day basis, because the ability to understand them will allow us to voice concerns that could be emerging, allows us to suggest potential changes that workplaces should be making. If, for instance, these tools aren't adopted in a way that are healthy and safe for those within our working environments. Um, and I think that can be quite daunting for many people. But
Mhm.
I think this is not just like kind of a worker message. I think it's kind of more of a societal kind of message that we
Right.
need to think about how to better acquaint ourselves with these new technologies so that way we can contribute to discussions on how they're used and flag concerns that we might have that could exist.
That makes sense. Is there anything else you'd like our audience to know before we wrap up?
Yeah, I think the future, when we think about it, it's kind of this constantly changing picture. And so we looked at signals of change at one point in time, but I suspect if we were to conduct the same process right now, or 6 months from now, or a year from now, our picture of the future will change. And I think this kind of like dynamic and adaptable approach is necessary. I think we need to kind of
Mhm.
be aware of the changes amongst us, and then be able to adapt to them. And I think it just takes a more kind of dynamic approach to health and safety that I think would be effective. And that is not just like health and safety leaders; it's workers, it's employers, it's policy leaders. I think things are becoming way more complex in my view, and it's
Yeah.
important that we acknowledge that and be willing to kind of adapt as things evolve.
Thanks so much for joining us today, Dr. Jetha.
My pleasure. I'm happy to be here.
The study team's full report is available on the Institute for Work and Health's website. And as always, you can find information on a broad range of occupational health and safety topics on our website, ccohs.ca. Thanks for listening and stay safe out there.